Right, I'm going to go ahead and get started. Welcome, everyone, and thank you all for joining us for our webinar, Reaching the Unreachable, How God's Love We Deliver Engages Medicaid Populations. I'm going to be today's moderator. My name is Jennifer Flores, and I'm the Senior Strategic Growth Manager here at Blooming Health. For those of you who are not familiar with Blooming Health, we are focused on helping organizations better identify and address the social barriers that impact healthcare outcomes. Through our AI-enabled engagement and care coordination tools, we help ensure outreach, follow-up, and gap closures are not only initiated, but completed in a meaningful and measurable way. I am super excited to be joined by two incredible individuals from the God's Love We Deliver team, Chief Growth and Strategy Officer Eric Rockman and Process Improvement Manager Alexandra Roem. Our team at Blooming Health have been absolutely honored to have been working with God's Love We Deliver for a little over a year now. Today, we will be discussing what it actually takes to connect with high need populations, the barriers they face, what builds trust, and how community-based organizations and health plans can work together more effectively. Before we get started, Eric and Alex, can you please introduce yourselves and tell us a little bit more about your roles at God's Love We Deliver?
Sure. Thank you so much, Jennifer, and thank you all for joining us today. Again, my name is Eric Rockman. I'm the Chief Strategy and Growth Officer here at God's Love We Deliver. In my role at God's Love We Deliver, I oversee a couple of different areas, including our research and evaluation, and policy and advocacy work, really to help to show the proof of the outcomes that we see with medically tailed meals and food as medicine services, and advocating for them at the state, the city, local city, and state and federal levels. Our process improvement team or strategic operations team, which Alex is a part of, which really helps with our a lot of our work around process improvement, project management, our systems and IT teams, as well as our compliance team. So excited to join you all and talk a little bit about the work we do and how we are reaching the Medicaid population and beyond. And I'll turn over to my colleague Alex to introduce herself.
Thanks, Eric. Hi, everyone. My name is Alex Rome. I am a process improvement manager here at God's Love We Deliver. I've been with the organization for quite a while, and I am now housed within the strategy and growth team, where I work on a lot of projects that help us move to kind of a better space for supporting staff and for supporting clients. So I have been the project manager for our launch with Blooming Health, which has been really wonderful, and they've been a fantastic vendor to work with. So I'm excited to be here with you all.
And sorry not to put some spotlights on you, Alex. I did see on LinkedIn it is your work anniversary, so congratulations.
Thank you.
And
Yes, it's been 9 years, which is hard to believe, but it's great.
that's amazing. And sorry, I just jumped completely ahead. Housekeeping items, all the participants are on mute, but please feel free to introduce yourselves in the chat and also ask any questions. Well, let's get started. Um, I know you all introduced yourselves, but can you tell us a little bit more about God's Love We Deliver, the mission that you all have, and the communities that you serve?
Absolutely. So God's Love We Deliver is a non-sectarian nonprofit organization that's located in New York City. We have been around for 40 years. So actually, as of this year, we are celebrating our 40th anniversary. And God's Love started during the AIDS crisis, providing meals to people living with and dying of AIDS. Our founder, Ganga Stone, was actually a hospice worker and went to deliver a bag of groceries to a gentleman who was sick with AIDS. And she quickly realized that he was way too sick to cook for himself. So she organized the community and started to have individuals come together to provide hot meals to that client. And from there, our one woman serving one client, we now serve close to 15,000 clients a year, delivering upwards of 4 million meals a year across New York City and the state. We have expanded our service, so now we serve over 200 plus chronic conditions and diagnoses. That includes diabetes, cardiovascular disease, cancer, women who have gestational diabetes, and various other pregnancy-related diseases. as well as our veteran population. So we expanded and really have started to serve veteran clients with PTSD and other mental health diagnoses to support them kind of in their with their nutritional needs. The organization is powered by 20,000 volunteers a year who come through and support our kitchen operations and delivery operations. So, based in New York City, we do actually home cook all of our meals in our kitchen. All of the meals are prepared under the direction and supervision of a team of registered dietitians who help to really tailor the meals to those individual chronic conditions. They also provide nutritional counseling education through the lifespan of the client to support them on their nutritional journey. And then after we home cook them, we actually then deliver them in our own fleet of vans. We have a fleet of 35 delivery vans that go into the city and hand deliver the meals to clients to their door. We like to say we don't only deliver meals, and you'll see on the screen, but we deliver hope and dignity and love to the clients we serve on a daily basis. We're really pleased to be able to talk about the work we do and all the work we're doing in expansion with Blooming Health to really reach our clients in a whole new way.
That's incredible. Yes. And we love seeing your vans across the city. Our team is based, our organization's based in New York, but on our fun Slack channel, we always post the God's Love We Deliver vans every time we get to see them.
Love that.
Um, Thanks for your intro. From your perspective, why is it so important for organizations to take a more tailored approach when serving Medicaid populations or populations that are otherwise unserved or unable to be reached?
Yeah, I think it's a great question. We being an organization that has historically served the Medicaid population and being an organization that has actually several contracts with Medicaid managed care insurance plans and hospitals, Medicaid clients are often clients that have barriers to access to services, often are kind of left behind, and often have multiple comorbidities or multiple social care needs that really make it more complicated for them to get access to services and the service they need. Also, our healthcare system is hard to navigate, and they need support in being able to be connected to services in a meaningful way. We as an organization and an organization that's really engaged in providing support to health-related social needs, including nutrition services, have really focused on how we can, better serve clients more holistically, and really not only focus on the nutrition factors, but connecting them potentially to other services that can provide that wraparound holistic support for Medicaid members. Because we know that if a client doesn't have stable housing or doesn't have a way to get to their doctor, the meals are not going to be as beneficial and have the same outcomes if they have those other supports too. So all these things work together to really support clients, and we are committed to ensuring that Medicaid lives and all the clients we serve really have access to all the services to improve their health and well-being.
Definitely. And you mentioned connecting them with the correct resources, even outside of food and nutrition, is one of the biggest positives in creating more positive and engaging outcomes. What are some of the biggest barriers that you're facing with these populations just to get them to be engaged and then stay engaged?
I'll hand it to my colleague Alex to start us.
Sure. I mean, I think, Eric started to highlight, our clients, current and future, right? People that are just coming to us for the first time and clients that have been with us for some time. Things are constantly changing in their lives, right? So just because you're stably housed today, things might change in the future. So when we're looking to support clients, bringing them on board for the first time, that initial outreach, that's a one-on-one conversation that's happening with our staff. And we're asking a really detailed list of questions at that time to make sure that we have a full picture of what's happening for the client. And then, something like Blooming Health helps us to support the client through their lifespan on the program, right? So we can outreach to them in their native language via Blooming Health. Whether it's a nutrition webinar or an education, element, or we have a closure, right? We can speak to each client in their native language, and that's not an interaction that needs to happen kind of one-on-one, which would really be impossible for our staff. So that initial outreach is really, really key in that one-on-one space. All of our interactions for intake happen over the phone with our staff. And then the support of Blooming Health allows us to access clients more regularly to stay in touch with them to make sure that we're getting them what they need.
Yeah. I would add to that that I think, we are a company that's really focused on personal touch and really providing a highly tailored service to our clients, hence medically tailored meals, right? It's very personalized for an individual in their nutrition journey. And so, we are very high touch with our clients. We really believe in having that person-to-person connection, having our drivers have those interactions with clients and delivering the meals and handing it to them. And I think that, very often people think that adding technology can create impersonal touches, but I think it enhances the way we serve our clients in really creating those personalized messages. Using Blooming Health and that technology has really enabled us to, communicate with clients, like Alex said, in their native language, using tags and things that help to really make those messages personal for them. And I think through that, we are seeing increased engagement in using the tool in supporting the communication with our clients and collecting information back in a really meaningful way. So, I have to say that, historically and being someone who's worked with the Medicaid population for a long time, there always is difficulty in communicating. And I would have to say that Blooming Health has really been an enhancement for us in supporting that connection to our clients and keeping them active on our program for a longer period of time.
Great. We mentioned talking about personal topics like food insecurity and serious illness. Those are some topics that many people feel a little bit nervous to talk about, are hesitant to discuss. How do you approach outreach in a way that feels supportive to them?
Yeah, that's a great question. I think that, again, clients, especially who have, lived with chronic conditions for a long time or have maybe not had the best connection or access to healthcare systems, often are afraid or feel stigmatized or don't want to share information in a vulnerable way. Being that our clients are living with multiple chronic conditions and are for the more majority homebound, and don't really have a way of necessarily interacting or leaving their apartment daily. I think that specifically we are, um, you know, we're constantly looking for ways to improve how we connect to them and how we work with them in a meaningful way. And so, again, this using Blooming Health and the various tools we've been using really helped to enhance that. So that that's a way we're continuing looking to do that.
And I'll just add to that. I think what's really special about God's love and the way that we interact with clients is, right, that personal touch from the beginning, right, with that intake. And then our clients also always can speak to an RDN. We have a full team of registered dietitian nutritionists on staff. They will speak to an RDN at the point of intake as well. So they'll complete their intake via phone and then speak with an assigned RDN for an assessment. And then they can speak to that RDN or that intake specialist at any time during the program, right? So that is really helpful, I think, to clients to know that they can pick up the phone and give us a call or send us an email. But we are, again, kind of, I think this word enhancement is really, really important because we're able to continue to outreach to clients in between those touch points of kind of person to person. So if we're doing a nutrition webinar about, a specific culturally appropriate preparing of foods in the fall or something like that, right? We're able to outreach to clients kind of on a mass scale and kind of invite them in to participate with us in a different way. But that engagement of person to person is always available, which I think clients really, really appreciate.
Awesome. And with working with you all for just a year and a half, I've noticed that you don't just hear your clients, you listen to them.
Mhm.
You change out different foods to make sure that they're culturally appropriate. Um, we have talked in the last couple of weeks about your halal meals program. I would like for you all to speak a little bit more about that, and I would also like other examples that you've taken client feedback and made more culturally responsive services, and how that can change someone's experience and willingness to engage.
Yeah, I think that we, being in New York City, we do serve a very diverse population, with, and we, like Alex said, we're always trying to adjust both the meals and our staff and services to meet cultural needs across the spectrum. Because of the requirements around halal meals, and kosher meals, it's a new thing that we just launched, that requires special requirements for food preparation, and so because of the need we were hearing for our partners and in the community for really developing a service for the halal population, we decided to launch this new service, in collaboration with a partner, called Golden Meals, who is really is the location where they're actually preparing the meals, and doing it under our guidelines and our guidance by our DNs to ensure it fits our medical teal model, but is under all of the strict guidelines around halal meals. This was basically a need that we heard from our community. We constantly are collecting feedback from our community about what they need and what they expect. And we also do this through we do regular surveys with clients, or through our client satisfaction survey. We actually this year are turning our survey into a digital first approach. Usually we would mail out the survey to close to 15,000 people, on paper, and have them return it. But with the support of Blooming Health, we've actually been able to take a different approach to the survey, in sending it out digitally. And we're actually just about to start that in this coming couple weeks. And we're expecting that we're going to have a lot more engagement and response from that survey, as we move forward, because of that digital first approach, with, of course, mailings going out later on for those who may not respond. But we want to hear from our clients. I think, again, the ability to communicate with people in mass, in their native language, personalizing that communication in a way that makes them feel like it's not coming from, an AI or a robot, is really meaningful. We have used other services before, mass text messaging and calling systems that didn't give those personal touches. And so, we have heard from our clients, very overwhelmingly, the positive nature of being able to communicate this way. And that collection of information just empowers us to serve our clients better, into the future.
Moving from kind of approach taking, going more into operations and workflow. Once one of your members is identified as needing support, what does it take operationally to make sure they actually receive the services?
Alex, you want to take that one?
Sure. So we have a wide kind of variety of ways that people can get to us, right? So we have a lot of different partners and a lot of different kind of pathways for people to obtain God's Love meals. So they could be coming from a health plan, they could be coming through the 1115 waiver, they could be referred by their doctor. So there's a lot of different team members that are helping to kind of corral all of those potential applicants. Not everybody will necessarily be qualified for meals, but we work through that. If someone doesn't qualify, we obtain, different resources for them. But that whole process is handled by our program services team, to make sure that, we're addressing things in a timely manner and getting clients on program as quickly as possible. And that's where that intake comes in. And then someone is passed on to their RDN. So we try and make it a swift process because we recognize people have a high need, right? If they're coming to us for meals, they would like meals as soon as possible. And so we try and make that as swift as possible for them to be onboarded. So getting meals could happen in a handful of days.
Yeah. And including that, we have several transition of care programs where we're feeding people directly out of their hospital stay, right? So these are individuals that are, coming out of a hospital stay, maybe coming home to not having any food available or not able to ambulate and really need the meal service. So, we are really responsive to those clients, all of our clients, but that group specifically, to ensure that we're getting meals dispatched within 24 to 48 hours, so that when they arrive home, they have meals available for them to eat, and to continue forward. So, again, I think we always try to meet the needs of our clients where they're at, and support them and through those various, methods.
Yes, amazing. And you mentioned earlier health plans and insurance and Medicaid, they're very hard to navigate. How do you coordinate with health plans, care teams, or other community organizations to make sure no one falls through the cracks?
Yeah, that's a great question. I think that we, especially with the Medicaid 1115 waiver, and the concept of a closed loop referral system, we've been really working with our partners to improve how we are communicating with them as well, not just our clients, but our partners, to assure them that you've sent us a referral, you've sent us a client, we are now serving them and we're providing that service to them. We're actually looking at ways in the future, through Blooming Health and other means to automate some of that communication as well to both our clients and our partners, so that they can get a message saying, client has now been onboarded, we have referral has been processed. And so that way, there is awareness from various individuals in that person's care team, whether it be the insurance plan, the provider who referred them, or whomever may be part of that, supporting that client, are aware that they're on service of God's love and are getting meals from us. I think that, for clients, that care coordination is really important, and really setting up ways that we can collectively, in a more coordinated way, support clients through these services, so that they are not just focusing on the meals, but can focus on the more holistic picture of what a client needs, is where we're going to be more successful in serving people for a longer period of time. We also, under 1115 waiver, set up a community health worker team that is helping to screen and navigate clients to services. And we envision that team continuing on in the future, not just in 1115 waiver, but serving all of our clients and helping really just support the connection to social needs and navigating those clients and being that kind of hub for the client through the whole process of their healthcare journey. And coordinating with, again, their care manager from the health plan, or a care manager from the hospital, or whoever they can help connect with, to really focus on the social needs side of healthcare.
Awesome. For our participants that may not currently work with health plans, or maybe smaller organizations that haven't moved towards that, what advice would you give them going into the process or trying to make the process stronger?
Yeah, it's another great question. I think that it can be daunting, I think, sometimes to work, especially as a CBO or a small organization, to work with health plans. What I'll say is that, we have found, more so over the last, I said, five to 10 years, that health plans have been more interested in engaging with organizations like ours or other CBOs, because they know that we are in the community. We're actually serving with people in the community. We are the boots on the ground, per se, that have that direct communication with clients, sometimes on a daily basis. And so, we really, when we are approaching health plans and talking about our partnership, we talk about it as a true partnership, that we are here with them to serve the clients, to improve their health and outcomes. I think, and full disclosure, first, being someone who used to work at a health plan, a lot of the health plans also want to focus on cost effectiveness, right? So really helping to understand, make them understand the return on investment that a service like us provides, from decreasing hospitalizations and improving health outcomes, improves their bottom line as well, and provides opportunity to not just improve someone's health, but save the healthcare system money in the way we serve individuals. So, we are really approach it as a partnership. We want to be equal partners with those healthcare institutions, whether a hospital or a healthcare plan, in serving the client. And we're looking for new ways too, as we move forward, to really support the health plans in the work they do. So, using our tools like Blooming Health or other forms, to maybe assist in other wellness checks, or, if we're going to a client's home and we're actually, a driver is, meeting with a client, there are ways we can also convey information or support the client in the mission of the health plan, or the hospital, or whoever, what healthcare organization you're working with, to get connected to that client as well. So, I think that CBOs play a really important role in that, and can really help support these healthcare organizations in having that connection to the client.
Awesome. Going back to meal delivery um, and medically tailored meals, how do you feel that meal deliveries, culturally responsive care, and medically tailored meals contribute to whole person care for Medicaid and Medicare populations?
Yeah, I mean, medically tailored meals, and again, being an organization that's been doing this for 40 years now, and an organization that's really committed to the research and improving the outcomes of how this service can do. We know the science behind how food as medicine can really help to transform the way someone manages their chronic conditions and hopefully gets better. As a medically tailored meal provider, we are usually serving the most acute population, right? These are individuals again who are very sick, have multiple chronic conditions, comorbidities, are homebound, have limitations, activities of daily living. But we see clients get better, and so we want to continue to help support them holistically in their healthcare journey. And so, for example, we've actually started to develop and launch. We've officially launched a medically tailored groceries arm under the Medicaid 1115 waiver to expand and allow to step down potentially clients from medically tailored meals to medically tailored groceries because they still need that nutrition support, but now they can cook for themselves. And so this allows them to still engage and get the nutritious food they need to maintain healthy, but in a different form, in a different way. And so we are continually thinking about how can we kind of serve clients through what we consider their life cycle, right? Someone who's not just in an acute state of health. If someone really, is coming out of a hospital and has a hospitalization, yes, we want to serve them, but how can we potentially even change that to serve them so that we're preventing that hospitalization in the first place, right? Preventing someone from becoming diabetic. And the beauty of nutrition services is that it's a core intervention for a lot of prevention for a lot of chronic diseases, whether it be diabetes, cardiovascular disease, and various other illnesses. So we do have a lot of opportunity and power to really change how clients receive services, and it being really thought of as an integral part of healthcare, and being a core service in the healthcare space.
Awesome. So you told us that God's Love We Deliver started about 40 years ago. From your perspective, I know you and Alex have both been a part of the team for quite some time. What does strong operational infrastructure look like when trying to scale this type of work?
Alex, you want to take that one?
Sure. I mean, I've been at God's Love for 9 years, right? And the program has changed a lot. What we do has changed a lot, but the core has remained the same, right? Speaking about what Eric was just talking about, right? Like, we often see that people are very sick, and we want to be able to serve them for as long as they need us, right? But the expansion of services and the serving of different population, has really, I think, strengthened us as an organization because we're able to serve people where they're at. So being able to serve a halal population that we've never been able to serve before, we're meeting the different needs of our community, right? Medically tailored groceries. We had a small grocery program years ago, but this is much more robust and we're able to meet people's needs much more quickly. So we're really excited about that because again, someone can come to us and say, like, this is the specific thing that we need, for this patient, for this client. This is what my mom needs. This is what my patient needs. And we have kind of a variety of things that we can offer people. And, previously it was medically tailored meals, right? But now, like with the expansion of services that we offer, I think that strengthens us as an organization, to kind of remain experts in medically tailored meals, but also recognize that maybe not everybody needs a medically tailored meal. And here is our expertise in medically tailored groceries and how we serve our halal population, our future kosher population. It allows us to really, be, strong in our community and able to meet people where they are.
Another thing I'll add there is I think strong operations require strong partnerships. We're very lucky to have partners with organizations like Blooming Health from a technology side, from Salesforce from our CRM. We have partners like Farm to People who helps us with our grocery program, Golden Meals, like I said, for halal meals. So we've developed a real incredible network of partners that really help us to do what we do every day. Yes, we're still doing the core things, and we are cooking our meal, the majority of our meals and in-house and delivering them ourselves. But through those partners, it extends our reach. We also have contracted with, for outreaching farther parts of Long Island and also upstate New York. We use third mile delivery partners, right, who really can help us to get our meals to someone's door, across the state. So those partnerships are key. And again, I think it's working together to serve everyone. We believe and what we hope, is that everyone in New York State who needs food as medicine and services can get it. That's our vision, our goal. And so we're committed to really helping to do that and working with other organizations in partnership, because the reality is that there's plenty of people to serve out there. And we all, whether it's a medical meal company, a food bank, we need the whole spectrum of food as medicine services and food as medicine organizations to serve clients in need.
Awesome. You mentioned that you all serve about 15,000 individuals every year. I'm sure that's probably impossible to call 15,000 people a day and let them know your meal is coming or just checking in on them to see what resources they need. How do you use technology to maintain that personal human touch while managing the sheer volume of clients that you serve?
Yeah, I can start on that. I mean, I think this is where, we just talk about Blooming Health all the time and how it's kind of transformed how we're able to communicate with clients, right? So recognizing we don't have 15,000 intake specialists, right? We have 15,000 clients, but we don't have, the staff ratio is quite small. So being able to do that one-on-one outreach to clients for that initial onboarding, but then have that staff be able to be supported by I have 500 people that I need to call this week about their paperwork. How am I going to do that, right? So it's been transformational for us to be able to put a script into Blooming Health and to text those people in their native language. That's not someone that has to figure out how to email people that have the email and to try and call some people, in English and call some people in Spanish and call some people in Bengali, right? Like Blooming Health is kind of one-stop shop for us to be able to get information out quickly because that is one thing for us. Things happen quickly, right? So we had a couple of blizzards this year, right? So we had a couple of snow days. It's crucial for us to be able to reach out to our clients who are at home waiting for food to say, here's what we're doing. Here's when you're going to get your food. Stay home tomorrow. We're going to get it to you. Stay safe. So being able to quickly get the right information to the right people in the language that they need, whether that's SMS or a voice call or an email, that's transformational for us, for our staff to be able to quickly turn that around and have faith that our communication is in the right hands of the clients, but then it's also the clients getting the information they need in the moment that they need it.
In addition, I think we are really trying to think outside the box of how we can leverage Blooming Health in other operational ways to communicate with clients. And so, for example, we are actually working on a project right now with Blooming Health to integrate Blooming Health through an API into our CRM Salesforce, so that it would give them automated messages based on certain things that may occur in their time with us. So, for example, if a client is getting a delivery and we need to want to, and this is new for us, we would reach out to them ahead of the delivery to confirm if they've received, if they're going to be home to receive the delivery, and through a survey through Blooming Health, really capture that information. If they confirm one yes, two no, bring that back into the system, and then if they're not going to be home, we can just automatically reschedule that delivery or move forward in not dispatching a van to someone's house to then that person maybe not be home. So I think there's a lot of different ways that we're thinking about how we can enhance our communication with our clients, create more personal touch for our clients, that is really going to be powerful and also making our operations more efficient so that we can continue to scale and grow and serve more clients over time. And so we're really looking forward to working with Blooming Health as a partner in enhancing those communication points and enhancing that personalization over time.
Awesome. We have a question in the chat. Do you envision this model working in a larger geographic area without the density of New York City?
Yeah, that's a great question. We are actually already serving the entire state of New York, so we do actually deliver meals throughout again through the 1115 waiver through the entire state, whether it be the Finger Lakes, Buffalo, Rochester, and a lot of the North Country of New York as well. We are continuing to think about how we can further enhance the model that we're providing. One way is actually we're exploring kind of developing a more hub and spoke model where we have regional distribution from, let's say, a city in Rochester or a place upstate to really have that last mile connection using our own drivers rather than using a different delivery service or a third mile delivery service. So we do get some benefit from the density in New York, being able to have 35 vans go across the city on a daily basis and do that is really makes it quote unquote easy, I would say, because we have that density in one place. But I think that, one of the things we're thinking about is, a lot of people living in rural areas don't have access to medically chill meals and foods, medicine services the same way that someone may have in New York City. And we got to figure out ways to serve both, right? We can't just focus on the urban areas. We have to focus on the suburban and rural areas too, and figure out ways to really design our models and our food delivery services to meet them where the clients where they're at. So we're really working on that and committed to that. And this is we're not saying this today, but over time we envision really having that supportive network of food as medicine services across New York State in this manner.
Awesome. Yes, definitely. Going back to the technology piece of things, for clients maybe in rural areas or CBOs or health plans that the clients maybe struggle with technology or maybe it's looked at as a scary topic or a negative topic, what advice would you give them to help them adopt more technology into their everyday operations?
Yeah, I think that one thing that we often, or I think it's really kind of a misnomer or rumor we hear is that that Medicaid populations and also older populations don't use technology. I think that's changed a lot. I think because of the pandemic, we saw a real increase in uptick in people using and engaging with technology, which to our benefit has really helped us in being able to outreach people using tools like Blooming Health and other technology tools. So I think for the client side, we do a lot also. But that being said, we still work to educate people who aren't necessarily technology savvy, right? So helping to put tools in their hands to increase their literacy with digital tools is really important and makes it easier for us to communicate and work with them. So we do find ways to do that with our clients. If someone is scared or doesn't want to use that technology or has hesitation about technology, of course, we always will provide the human option if needed, if someone doesn't really want to engage. But from also an internal organization side, I think that vendors like Blooming Health, for example, have made it really easy to work with technology to integrate it and build it into our workflows. And I think that it may feel daunting and may feel like you don't need necessarily a huge IT team or a huge systems team to support the implementation of software or services like Blooming Health and to really enhance your operations and enhance the way you communicate with people. So I think that it definitely technology and as we get into AI and various different technologies over time, we have to continue to learn how to use them and adapt with them, especially as community-based organizations who are working on a tighter margin with less resources, less staff. And so utilizing these tools, and I like to say this all the time, utilizing these tools helps us to really focus on what we do best, which is client care. And so we can take some of that administrative burden off of communication, take some of the time it takes to reach out to clients and communicate with clients using tools like this and other systems, and let people really have the human connection. Let our teams really provide the client care the best way. I always say that we have to leverage the technology and leverage the tools all the tools in our toolbox collectively to improve client care.
So, coming up on the last few minutes here, I would like you all to say if you could leave our participants with one takeaway from any of the discussion topics that we talked about today, what would it be?
Hmm. It's a great.
Well,
Alex,
I
you want to
think,
start?
yeah, I think just bouncing off of what Eric kind of was just alluding to, right? Like it can seem daunting, but I think like the idea of us starting with Blooming Health a year and a half ago, a year ago, right? Yeah, the idea of like training every, staff member that was going to use it and like how do we kind of plug our clients in and what is that all going to look like? But looking back now, a year and a half later, it has been, again, I'll also use the same word, transformational for us because what we went into it knowing is that we wanted to communicate with our clients in a more coordinated way, right? And so we were seeking a tool that would help us to do that. And even in our time as partners with Blooming Health, we've seen growth on the Blooming Health side, right? We'll say, "What about this? Can we try this? Is this something that's possible?" And the team at Blooming Health has always been super receptive to, okay, something is not quite working for us. Is there a different way we can work on it? And Jen and the team at Blooming Health has been super receptive to that. And those ideas then help us to serve our clients and meet our clients in a very different way. So I think, yes, it felt daunting and we were in kind of those seats. But I do think that the biggest takeaway for me is that this has been, kind of one of the strongest partnerships I've been a part of at God's Love. And it's been really, really supportive of our staff. And it helps our clients immensely. And as we continue to grow and serve new populations, we are communicating with everybody. And those, different communities, those different types of clients that we're serving might need different levels of communication. Maybe we're doing surveys to this population, but then, an SMS to this population. So the variety of ways that we can communicate and the variety of ways that Blooming Health continues to grow really helps us, meet the growing needs of our population.
Yeah. I think I'll go back to what I was saying about partnerships as the takeaway, right? I think it's really important for all of us, community organizations to partner with each other, for us to partner with healthcare, with technology providers, to partner with healthcare providers. It takes a village. It takes us all to come together to really serve clients in the right way. And none of us can do it alone. So we have to find ways to really, use partnerships. And like Alex said, the partnership with Blooming Health, and we really see it as a partnership, has been instrumental in our ability to communicate with the clients more efficiently, to decrease the administrative burden from staff, to really look at new ways of how we can serve people using the tools that Blooming Health is providing us. So we're very grateful to the Blooming Health team and all the work they've been doing with us. And really, like Alex said, we're really responsive in ensuring that that the tools meet our needs and meet the needs of our clients.
Incredible. And I promise we did not pay them to say that.
We did not.
Well, no, we're so blessed and honored to be partners with God's Love We Deliver alongside all of our partners on our platform. And those of you who have joined today and taken time out of your day, our ultimate goal as a technology partner is not to get as many people on the platform or as many messages out. It's the outcomes part of it. So it's making sure that people are getting the resources that they're needing in a timely manner, which is always encouraged and always important. Thank you all for joining our webinar. I did want to leave you all with one last thing. This was a little bit of a pep rally for the Blooming Health side of things. In a couple of weeks, we will be having our annual Blooming Day in New York City, and virtually it is a free event. And Eric will be one of our speakers at this event. So we're so excited to bring together CBOs, government agencies, health plans, healthcare partners into one space to have these conversations. So please feel free to sign up for that, and we'll send more information out as well. And you'll be able to meet us actually in person. So the God's Love We Deliver team and the Blooming Health team, we would love to see you all there. And again, thank you all for joining. Thank you, Alex and Eric, for hopping on and sharing your amazing stories and the amazing work that God's Love is doing.
Thank you so much.
Thank you.